Well, this is a first. When you do what I do for a living, the last thing you want to do is start talking about it just after people have finished eating. So for those of you who are a bit squeamish, I will tone down the technical details of what we do, but I would still try and convey why it's important and why other people seem to think it's important as well. So if I was to tell you that we developed an MRI-guided transurethral technology to thermally ablate the prostate, that probably wouldn't mean a lot to many people in this audience. So my talk is going to be around kind of simplification of message and communication and credibility in conveying the information with the technology you've got. So, as I said, MRI-guided transurethral thermal ultrasound is a bit of a passing ship. If you want to convey what you do with any form of credibility, it's easier in many circumstances to do so with an animation. So what Profound does is develop a guidance system that can be used in an MRI suite, which is a very difficult engineering environment. And what we are trying to do is deliver energy and treatment to the prostate without damaging the critical structures around the prostate. We do so by using MRI, and I'm sure many of you are familiar with MRI. What we do is take real-time virtual images of prostate directly over some transducers that we placed in the device. We very gently but critically heat the prostate to a prescribed boundary in 30 minutes, non-invasively. Now, why is this important? This is important, and this is where we get squeamish around the food, and most of the gents in the room start crossing their legs and probably get a few tears in their eyes. Prostate cancer is a massive market. It's a massive problem. Over 500,000 people a year, and I mean exclusively men, 500,000 men a year are newly diagnosed with prostate cancer. The good news is that if you're diagnosed early enough and you've had a PSA test, you will, if treated, have a 99% survival rate after 5 years. So that's great news. The bad news, the dirty little secret of the industry, and it's a very big one, is that 50% of men post-treatment, a full 50% of men post-treatment, are either incontinent or impotent or both. I'll say that again because that's pretty important for 250,000 of those men every year. 2 years post-treatment, you are incontinent or impotent or both. And when at the age of 65, 1 in 2 men are diagnosed with latent prostate cancer or lesions, that is a huge problem. Now, many of the young men in the room are going, okay, prostate cancer's got nothing to do with me. Many of you, I hope, as you do, will grow to 75 or 85. Prostate cancer will be a part of your life, or probably has been in some way, shape or form, a part of family members of your life. What Profound has done is develop that technology to a point where over the last 4 years, we've been able to convey what we do and the importance of what we do in a manner that has a high level of credibility to potential investors. Now, John mentioned the word disruptive earlier. When you're looking for venture capital financing, you better have a high level of credibility, a lot of answers to a lot of tricky questions, and a technology that, when you convey its benefits, is very, very easily and well understood that it can change the game and change the nature of the way a disease is treated. And that's what our technology can do. So, building Profound's credibility from 2008, when we initially had a $2.5 million venture round, I and the team at Profound put into play a set of strategic drivers to build that credibility. We did a number of things. We had a management team, small, but experienced in startup companies and engineering of complex medical devices. We were able to go out and talk to anyone who else has understanding and capability from the venture capital side in a term and manner that they could understand. So we get them and they get us. We're bridging the gap of communication. We've managed to build a high level of credibility by securing Siemens AG, not Siemens Canada, but Siemens AG, the big headquarters over in Germany, as a strategic partner in our clinical trials. We have a stellar clinical advisory board in Sunnybrook, Harvard MGH, Cleveland Clinic, and the biggest urology center in Europe at the University of Vienna. We have human proof of concept data. We've identified and have clinicians in North America who will speak highly about what we do. Same thing in Europe. And like other, like RNA diagnostics, have applied to a number of competitions and been successful in winning them. So those of you here who are thinking of building medical device companies, it is a daunting task. There are many regulatory, or in many cases, many regulatory hurdles to jump. But you can do it, and anyone in this room can do it if you're very clear about how you plan to set out and what your value proposition, what you're trying to sell is. If you're consistent and you practice that message, if you really do have something very attractive, it's a case of dressing it up in a tidy bow, getting the credibility around it that other people will buy into, and then selling that. So I'm going to talk a bit about, as we go forward, just some of the things I think about when I'm trying to build the credibility and understand what I've got for those of you entrepreneurs in the room who are thinking of building a medical device company. The good thing, the encouraging thing, no matter how complicated your device is, and as you can see our device is very complicated, is that it can be done with a small team. This entire effort was done by 6 people. Profound was 6 people to begin with. So we had a couple of consultants, myself and an engineering team of 5. And we managed to build this level of credibility and this depth of capability just out of those 6 people. To the point where we were able to persuade venture capitalists who are very knowledgeable, see prostate cancer technology pitches on a monthly basis, and have operational experience themselves through regulatory and commercial development to buy into Profound. How do we do that? Well, I like to boil things down to common sense if I possibly can. So I tend to look at whatever the technology is, however you contemplate its value, as looking at it as simply as you possibly can and kind of drawing some basic lines down about what it is you're doing and why it's important. Those of you who have any marketing background or even have picked up any book about marketing or seen a couple of sheets about it will understand the 4 Ps, the 7 Ps, the 11 Ps. But it kind of boils down to product, price, place and promotion. If you, or if I, as I typically do, map along that customer, competitor, and company, you've got a little matrix. There's a box, there's 12 boxes. This is a tool I use. It's not necessarily, I think, a tool everybody else uses, but it's one I found that's quite simple and easy to help me understand what I've got and whether it's valuable in the market or not. So this is a customer-facing, a market-facing, simple, realistic evaluation of what you could do. So to give you an example, let's just look at the pricing. You're looking at the customer. There has to be a willingness to pay from the customer for whatever it is you want to sell. The key question you need to ask yourself is, how does that price compare that you want to sell it to the customer relative to the competitor? It's a really simple question. And if you understand your market in any way, shape and form, you ought to know who all your competitors are and roughly what their price points are for your product. So if you have a belief that your thing, your widget is worth more than someone else's widget, you better be able to determine how much that's actually worth. And the critical question on top of that is, can you, as a company, whether you're virtual or a manufacturing company or you outsource, can you make the product over here at a price, or cost of goods as is commonly stated, low enough so that when you sell it to your customer, there's a margin to be made? If you can't, you need to seriously think about what you're doing and how you're doing. And you can ask yourself 12 questions relating to each of these and get a decent understanding, if you are as objective as you possibly can be, about how you can roll out a product and look at some of the key issues going forward. And that's just selling it, positioning and selling it. That's not any of the regulatory That's not any of the hurdles, that's not any of the reimbursement issues. That's just basic common sense on whether you can take a technology to market or not. Another classic old consulting tool is a 2x2 matrix. John's, I think, put up 3, and they are very valuable. Again, if you are subjective and honest with yourself in the early stages you're trying to build a med tech company, you ought to be able to put down a number of 2x2s and put a number of axes up. And knowing your competitors and being as objective as you can be, you ought to be able to determine if what you're doing occupies a unique space or not. If it does, in many places, that's very attractive. You need to start ordering and prioritizing which of those are most important to potential buyers out there. And when we're talking about buyers, we're talking about multiple levels of buyers. First buyers are investors, because without their money, you aren't going to be able to take this anywhere. So look at the angles, the X and Y, and determine if those drivers are strong enough to encourage and entice someone else to invest in your company. And then coming back to what I was saying at the beginning, you need to be credible. If you are going to go and pitch to venture capitalists actually, let's be serious, if you're going to invest to anyone, even friends and family, and you're going to ask your aunt or grandfathers or father-in-law or mother-in-law to put in $50,000 or $10,000 or even $5,000, a family member, what they can actually afford because they love you and you're a family member, there's a certain level of credibility you have to have with those family members. But then if you want to go up the food chain and you want to go to angel investors, you have to have a more credible, more robust plan. You have to have a better story, and you have to be used to people asking awkward questions. Very often questions you may not know the answer to at the beginning. What I've found and what Profound has found has worked is that a killer pitch deck is just the start of it. You need to have all of the other things, or as many of the other things in place, in no particular order here. Your intellectual property, for most people in medtech, really need to have their act together. It's better if you've got a working prototype so someone can press the button, fiddle with the device, see it in action, and if they can't, show them an animation of how it could possibly work. It helps if you have a company brand. I broke a second thing I've done differently today. I actually broke a personal rule, and this is the first time I've ever done slides since Profound existed outside of company colours today, so you were very persuasive. These two completely ignored it, but never mind.
We'll send it back to you, you can put your logo.
That would be very kind, thank you. It helps if you've got someone who's a front man or a front woman that's experienced in talking to VCs, has a network with VCs, has a network with angel investors. And if they don't, it's very helpful to be able to find someone who does, so you can get warm introductions. As I mentioned at the beginning, a capable and relevantly competent management team is extremely important. If you're not competent, why is anyone going to give you any money? It's extremely valuable, and actually, you know, John's presentation was a perfect example of a great short, tight pitch deck, building the need, the product, the opportunity, the path to market, and at the end there, the video, exactly as I would have done it under the same circumstances, of a set of knowledgeable key opinion leaders who will say great things about it. When you have large industrial companies who will say your thing is good, and when you have key opinion leaders from the clinical side who say your thing is good, venture capitalists, when you're looking for $5, $10, $15 million, are more likely to listen to what it is you've got to offer. External validation is an extremely powerful tool in getting people to invest in what you do. As I say, this is not really a pitch for Profound, but more some of the pieces of advice that I would think of, or I was thinking of a couple of years ago when I was starting out Profound. This is a source, these are not in any way, shape or form an exhaustive list of the sources of financing, just here, that you can access in some way, shape or form in Ontario if you get your act together. And by getting your act together, for those of you in this room already understand that. You're here, you're networking, you're talking to people from various sources of financing, whether they be government, pseudo-government, private, NIH, Canadian, European. To give you an example, I put this slide together at about 9:30 this morning. I'd spent maybe a minute listing all those down. Half an hour later, we got an email come in that the US military congressional funding is putting together an $80 million program for financing for prostate cancer, $120 million for breast cancer, just announced last week, and it just came through. I also missed off OETF, which has got $190 million in it, OVCF, which has got $220 million in it. There's an absolute slew of financing opportunities out there. It's a question of being networked, it's a question of being aware and cognizant of the timing of when these monies come in and when they are deployed. So Profound has been, I'm very happy to say, the recipient of Mars IAF money, Mars BAP, OCE, ONE, IRAP, HTX, FedDev, SODEP will announce next week. SHRED, very important point I'd like to make that was presented earlier. SHRED represents on the efforts that Profound is doing in the medtech space annually approximately $750,000 of working capital that returns and is directly invested back into Profound Medical every year. If we lose 15%, as Bob was suggesting, that actually shortens my company runway by probably 3 to 4 months. And that's a long time when you're a startup biotech trying to build. There are other sources of funding. As I say, the NIH R01 and the NIH R21 are different ones. We've currently applied for the PCC and the CCS. The only one I can't get in is OBI, I think, Ontario Brain Institute. Well, some people might say we're dealing with the second brain of a human. I'm an entrepreneur. I can probably try and make a credible case that there is brain technology around there that probably deserves some form of funding. The genomics side, I think we'll leave that one to you. That's one where we probably can't. But really, I guess the advice is, if those of you, and my advice is to those people who are starting up medtech companies, focus on having, whether you're looking for 50 grand, 500, 5 million, focus on having a market-facing plan. Make sure that you are prepared to be shot down in flames, as I have been in front of venture capitalists many times, and I'm sure you have, and I'm sure you have when you've been out there pitching. And be confident in the knowledge that what you've got and the work that you've done around it in establishing its credibility, you know more than the guy or the woman VC on the other side of the table. Because inevitably you do. And VCs, when you're in a pitch, tend to like to bully you. They tend to like to let you know they know more about your technology than you do. And that's inevitably not the case. You know more. So stick to your guns, believe in what you're doing, don't be intimidated, and if you don't know an answer, this is a really important one for credibility. Don't BS. Because the second you BS and you get caught, you will go down in flames. You're done with that venture capitalist. So prepare, continue to have a market focus, get networked on sources of financing and funding along this list, and look very carefully about the timing and the quantum amounts of money you've got. If a team of 6 at Profound can do a $10 million round and overall bring in 15 million from these other sources, everyone here in this room can do it. Just a case of application and practice. That was really it. I think I can keep my time to my time. If anyone, I'm happy to offer time, phone calls if anyone wants to call me up, and I'm not going to give you like 4 hours of my time in the office, but if anyone wants to know anything more about the programs back here, and you want to, you've done a little bit of work yourselves in determining which one of those are valuable or potential for you, I'm very happy to pick up the phone, spend 5 or 10 minutes giving you a few more details about the how, the whens, the whats, or if it's HTX, you can ask John directly. He's right there. Thanks.